You reach over to turn off the alarm, and your hand isn't quite there. Not painful, not paralyzed, just absent. Like someone filled your fingers with wet sand overnight. You shake it out, you flex your wrist, you wait for that pins and needles buzz to pass. And it does, usually within a minute or two. So you get up, go make your coffee, and you don't think about it again. Until it happens the next morning. And the morning after that. I've heard this story hundreds of times. And I mean that literally, hundreds. From patients who came in for something else entirely and mentioned it almost as an afterthought. Oh, and my hands go numb at night, but that's probably nothing, right? Here's what I've learned to say when I hear that. No, it's not nothing. It might be several different things, some minor and some not, but it is never nothing.
And the casual dismissal of it, the "I'll just shake it out" approach, has cost some of my patients more time and more health than anything else they came to see me about. So if this is happening to you, stay with me, because what I'm about to share might be the most useful 15 minutes you spend this week. The first thing I want to address is the assumption most people make. They assume it's how they slept. The position, the pillow, maybe they slept on their arm funny and compressed a nerve, and that's all it was. And sometimes that's true. Sleeping with your arm folded under your head or your wrist bent at a sharp angle can temporarily compress what's called the ulnar or radial nerve and cause that familiar numbness. It fades quickly, comes back rarely, and isn't a pattern. But here's the distinction that matters. If you're waking up with numb hands more than once or twice a week, if it's in both hands rather than just one, if it lingers more than a few minutes, or if it's starting to happen during the day too, that's not a sleep position problem. That's a pattern, and patterns mean something. I think about a patient I'll call Margaret, 71 years old, retired school teacher, sharp, observant woman. She mentioned the hand numbness to me in passing, almost apologetically, during an appointment about something else. She said she'd had it for about 8 months and just assumed she needed a different mattress. 8 months. By the time we did a proper workup, we found 3 things going on simultaneously, and the most important one had nothing to do with her hands at all. I'll come back to Margaret. But first, I want to walk you through what's actually happening inside the body when this occurs, because understanding it changes how you respond to it. Think of your nerves like electrical wiring in an older house. When the wiring is new and the insulation is intact, the signal travels perfectly. Flick the switch, the light comes on. Clean, fast, reliable. But over time, with pressure, with inflammation, with nutrient deficiency, with certain medical conditions, that insulation starts to thin. The signal gets fuzzy, or it doesn't travel at all. That's essentially what's happening when your hand goes numb. The signal from your brain to your fingertips, or from your fingertips back to your brain, is being interrupted somewhere along the line. The question, the clinically important question, is where and why. Because the where and the why can range from something as straightforward as a compressed nerve at the wrist, all the way to something as serious as early diabetic nerve damage or cervical spine changes that are putting pressure on nerve roots closer to your neck and shoulder. And the difference between those things matters enormously, not just for treatment, but for what happens if you leave it alone. Let's start with the most commonly recognized cause, because it's worth clearing up a few misconceptions. Carpal tunnel syndrome. Most people have heard of it. It's a narrowing of the tunnel through your wrist that the median nerve passes through. And when that nerve gets compressed, you get numbness, tingling, and sometimes weakness in the thumb, index finger, and middle finger. Now, the reason I bring this up first isn't because it's the most serious. It isn't. The reason is that after 60, carpal tunnel becomes significantly more common, and it often gets worse at night, specifically because of how fluid shifts in the body when you lie down. Gravity isn't pulling that fluid away anymore, so it pools slightly. The tunnel gets a little tighter, and the nerve gets a little more compressed. This is why so many people notice it most in the morning. What surprises people is how often carpal tunnel at this stage of life isn't caused by repetitive handwork. It can be driven by hypothyroidism, an underactive thyroid. It can be made significantly worse by fluid retention from blood pressure or heart issues. It can be triggered or intensified by certain medications that cause subtle swelling in the tissues. So when someone comes to me with classic carpal tunnel symptoms, I don't just look at the wrist. I ask about thyroid function, I check for signs of fluid retention, I look at their medication list. Because treating the wrist without understanding what's driving it is like fixing a symptom while ignoring the cause. Now, here's where I want you to pay close attention. Diabetic peripheral neuropathy, nerve damage caused by chronically elevated blood sugar, is one of the most underdiagnosed conditions I encounter in people over 60. And I say underdiagnosed, not because doctors don't know about it, but because the early stages are so easy to dismiss. It doesn't announce itself loudly. It starts as a mild tingling, an intermittent numbness, a slight reduction in the sensation in your fingertips, sometimes your toes. It often begins at night, when the body is at rest and there's nothing else to distract you from the subtle wrongness of it. Here's how blood sugar damages nerves, and I want to explain this in a way that actually sticks. Imagine your nerve fibers wrapped in a thin protective coating, like a garden hose with a thin rubber exterior. Chronically high blood sugar is corrosive to that coating. Not quickly, slowly. Over months and years, it eats away at that protective layer, and the nerve underneath becomes increasingly exposed, increasingly unreliable. The tragic thing about this is the timeline. By the time people notice significant numbness or pain from diabetic neuropathy, the damage has often been accumulating for years. Years during which the blood sugar was borderline, not high enough to get a diabetes diagnosis, but high enough to be doing quiet, consistent damage. If you have any history of prediabetes, elevated fasting glucose, a family history of type 2 diabetes, or if you've been told your A1C is a little high and you're waking up with numb hands, please bring these two things up together at your next appointment. The connection matters. This is the one that surprises people most, your neck. The nerves that control sensation in your hands don't originate in your hands. They originate in your spinal cord, pass through your cervical spine, the bones in your neck, and travel all the way down your arm to your fingertips. When those bones change with age, which they do, when discs thin, when bone spurs develop, when the space around a nerve root narrows, the signal coming down to your hand gets disrupted. And it often shows up at night, when lying down changes the position and load on your spine, sometimes compressing structures that weren't compressed when you were upright all day. This is called cervical radiculopathy, and it's more common after 60 than most people realize. The giveaway clues are specific. If your numbness tends to be in one hand more than the other, if it sometimes travels, starting in the neck or shoulder and radiating down the arm, if you've had neck stiffness or aching in the upper back that you've been attributing to tension, if turning your head sharply sometimes sends a brief electric sensation down your arm. Any of those alongside hand numbness, and the cervical spine needs to be part of the conversation. The good news, and I mean this genuinely, is that cervical radiculopathy is often very manageable. Physical therapy, specific exercises, sometimes a particular sleeping position with the right pillow support. Many patients see significant improvement without any invasive intervention at all, once they know what they're dealing with. Let me come back to Margaret for a moment. I told you we found 3 things. The first was mild carpal tunnel. The second was early cervical spine changes. But the third one, the one I most needed her to understand, was a circulation issue. Her blood pressure had been managed for years, but what the nighttime hand numbness led us to look at more carefully was her peripheral circulation. The vessels supplying blood to her hands and fingers were showing early signs of reduced efficiency. Not dramatically, not dangerously in that moment, but measurably. Poor peripheral circulation and nerve numbness can mimic each other and also compound each other. When circulation is reduced to the extremities at night, because blood pressure is lower during sleep, because the vessels are stiffer than they once were, because warmth and movement aren't helping, the hands and fingers become starved of both blood and oxygen, and that starvation feels like numbness. There's also a condition called Raynaud's phenomenon, which is more common in women and involves the small blood vessels in the fingers overreacting to cold or stress, causing episodes of dramatic color change and numbness. Not dangerous in its mild form, but important to identify because it can sometimes be a sign of underlying autoimmune or connective tissue conditions. I mention this not to alarm anyone, but because the conversation between poor circulation and hand numbness is one that needs to happen with a physician. Not because the outcome is necessarily serious, but because you can't manage what you haven't identified. I want to spend a few minutes on something that I feel doesn't get nearly the attention it deserves in primary care settings: vitamin B12 deficiency. Here's the thing about B12. It is absolutely essential for maintaining the protective myelin sheath around your nerve fibers, that coating I described earlier. Without adequate B12, that sheath degrades. And when it degrades, nerve signals become inconsistent, misfiring, sometimes absent. The result? Tingling, numbness, often starting in the hands and feet, often worse at night. Now, why is this a particular concern after 60? Because the ability to absorb B12 from food depends on something produced in the stomach called intrinsic factor, and the production of intrinsic factor declines with age. It also declines with the use of proton pump inhibitors, those acid-reducing medications that millions of Americans take daily, often for years, and with metformin, the common diabetes medication. If you've been on a proton pump inhibitor, Prilosec, Nexium, Prevacid, any of those, for more than a year and you're experiencing hand numbness, ask for a B12 blood test. It's a simple, inexpensive test, and I've seen B12 deficiency fly completely under the radar in patients for years. The reason this matters urgently is that B12-related nerve damage, if caught early, is largely reversible. Supplementation, often in a sublingual or injectable form that bypasses the absorption problem in the stomach, can restore levels and allow the nerves to begin recovering. But if it goes on long enough, the damage becomes permanent. And that window, that period of reversibility, is not infinite. I want to raise one more cause. And I want to raise it carefully because I don't want to frighten anyone unnecessarily. But it would be irresponsible of me not to mention it. In some cases, not all, not most, but some, hand numbness, particularly on the left side, that's accompanied by other symptoms, can be related to cardiovascular circulation. Not a heart attack in progress, but a signal that the heart isn't pumping as efficiently as it should, and that the peripheral circulation, the farthest reaches of the circulatory system, meaning your hands and feet, is feeling it. When the heart is under strain, it prioritizes blood flow to the vital organs. The extremities can get a little less, especially at rest, especially at night. If you're waking up with numbness that's predominantly on the left side, hand, arm, sometimes the face, and you've also noticed any new fatigue, any shortness of breath with mild activity, or any episodes of dizziness when you stand up, please don't file that away for later. That combination needs a conversation with your doctor soon. Not next month, soon. I'm not predicting anything catastrophic. I am saying that the body rarely wastes a symptom, and when multiple symptoms start pointing in the same direction, that deserves a response. Let me bring this back to something concrete, because I never want to leave a conversation in a cloud of concern without offering something solid to hold on to. Start by actually documenting what's happening. Write down, even in your phone, which hand or hands, how long it lasts, whether there are other symptoms alongside it, and whether it's been getting more frequent or more intense over the past few years. That information, presented to a doctor, transforms a vague complaint into a clinical picture. Ask specifically for a B12 level test if you haven't had one recently, especially if you take acid-reducing medications or metformin. Ask whether your thyroid has been checked within the last year. Ask whether your A1C and fasting glucose are truly within normal range, not just borderline acceptable, but genuinely healthy. At home, pay attention to your sleeping position. A neutral wrist position, not bent, not folded under, reduces pressure on the median nerve. Some people find that a basic wrist brace worn at night, available at any pharmacy, dramatically reduces the morning numbness from carpal tunnel. It's an inexpensive thing to try while you're working through the other questions. Think about what you're eating. B12 is found predominantly in animal products: meat, fish, eggs, dairy. If your diet has shifted toward mostly plant-based foods, or if you've significantly reduced animal protein intake without supplementing, that's relevant information. And warmth. People with circulation-related numbness often find that keeping their hands warm at night, lightweight gloves, an extra blanket, reduces the frequency of episodes. It's not a solution, but it can tell you something about what's driving the symptom. I want to say something that goes beyond the medical for a moment. One of the most consistent things I've observed over decades of practice is the way people edit their own symptoms before they bring them to a doctor. They minimize. They second guess. They wait to see if it gets better on its own. They don't want to seem like they're overreacting, or they don't want to hear something they're not ready to hear. I understand that impulse completely, but I also know the cost of it. The patients who do best, who maintain their independence, their mobility, their quality of life longest, are the ones who stay curious about their own bodies, who treat a symptom as information rather than an inconvenience to be managed privately. Waking up with numb hands is information. It may be minor information, it may be more significant, but you can't know which without asking. And the asking, the actual conversation with a qualified physician, is the most protective thing you can do. I want to hear from you. Has this been happening to you? Is it one hand, both hands? Does it go away quickly, or does it linger into the morning? Have you brought it up with your doctor, or has it been one of those things you've been quietly managing on your own? Tell me in the comments. I read them genuinely, and sometimes what one person shares gives language to something another person has been struggling to describe. If there's someone in your life, a spouse, a sibling, a friend, who's been shaking out their hands every morning and calling it nothing, share this with them. Sometimes we need someone else to tell us that a thing is worth paying attention to. There's another video here that I think you'll want to watch next about nighttime leg cramps and swollen ankles after 60, and what those two things together can signal about your cardiovascular system. It connects directly to what we talked about today, and the information in it is something I wish every patient over 65 had heard years earlier. Take good care of yourself, and the next time you wake up with that familiar buzz in your fingers, don't just shake it out and move on. Listen to it.